My name is Clay Hilton. I'm an associate professor and wildlife veterinarian here at Texas A&M University, Kingsville. Back in 1999, I turned my back on an angry cow and she headbutted me in my lower back, and it threw both sacroiliac joints in two different directions. I went from being very, very active to where I couldn't even get milk out of the refrigerator without taking a risk of hurting myself. Riding horseback means everything in the world to me, and I was where I could no longer ride. But every once in a while, I would do something wrong and it would just send off shooting, very acute pain accompanied by the chronic nagging pain, in addition to the mental pain of wondering, when's the next time I'm going to hurt myself and make this worse? And that severely interfered with my quality of life. And that's when I sought help.
My name is Matthew Thomas Alexander. I'm a neurosurgeon. I'm board certified. I am practicing in Corpus Christi, Texas at the South Texas Brain and Spine Center. We do predominantly adult neurosurgery. We see a lot of patients with degenerative spine disease and back pain. Overall, the SI joint is overlooked. And a lot of times I see patients who have other types of surgeries and they still have back pain. And when you dig deeper, really it's not the source of their pain is not the back, but it's actually in the sacroiliac joint. The SI joint connects your sacrum to your pelvis. The joint itself in women, childbirth causes it to expand. The literature shows about 40% of patients with prior lumbar fusions, the stress of the fusion can cause stress laterally into the SI joint, causing back pain. All the stresses, our whole body, our head, our arms, our whole body is floating on and putting pressure on your SI joint. It's really your clinical testing on the patient to see where you can reproduce the pain. If the patient does have a positive point tenderness at the SI joint and they have other clinical findings when we test them, we have them go for the diagnostic injection. So once the patient's failed conservative treatment, physical therapy, injections, then we discuss what we can do surgically.
And when I was doing my own research, as I came across the iFuse system.
The implant itself is very unique. Most implants are round and a screw design. This is triangular shaped, so it does not allow it to rotate, and it's very robust in width and its structure. The surgery itself is not very long. Through a very small incision, usually an inch long, where I do all of our surgery under fluoroscopy guidance, meaning that we use x-rays. We typically put 3 of these iFuse titanium implants across the joint itself.
When I woke up from the surgery, the pain from the joints being inflamed was already receding. Since I've had these surgeries, I've had multiple people say, "You look better." What I missed more than anything, even more than horseback riding, was sleeping well. I finally was sleeping through the night for the first time in 2 years. That made a big difference in my life. I'm a lot better off now.
Overall, the SI joint is a commonly misdiagnosed and even overlooked source of a patient's back pain. So if you do have back pain or even SI joint pain, please, we're happy to see you, evaluate you, try and get you better the best way we can, and call our office and we're happy to see you.